To our live stream. We're doing spine surgery at Duke Spine Institute. Our patient is having surgery on August 15th, 2023. We are going to be accessing the L3-4, L4-5 discs and shot. There we are. Now, let's focus on L3-4. Let's give some more numbing medicine first. We're going to be placing two needles from the left. She has a bilateral 4-5 and a left 3-4. I want to see if I can get the two discs access, 3-4 and 4-5, from the left side through one incision. Sometimes we're able to, sometimes we're not. Shot. This is going to be a tough one. I may have to start higher up. Shot. Yeah. I think we're going to have to start higher up. Shot. Yeah. Luis, I'm going to start up higher.
Yes, sir. Yeah.
Just because the angle is not good. Shot. 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 How is she, Dr. B? Shot. She doing good? AP?
How you doing, sweetheart? You all right? You doing, my friend?
From my standpoint, she's doing fantastic, but I want to make sure she's comfortable.
She might need a minute or two before we get this.
Yeah, no problem. All right, let's go back to the lateral. Looks perfect. So, folks, the first step in fixing a disc problem in the spine is to place the needle through the foramen into the proper disc that you want to treat. And that's what I'm doing right now. Shot. So far, things are going well for her. She's still a bit sleepy. We are going to wake her up in a little while, and we're going to test these two discs to see how painful they are for her. But remember, her biggest problem is actually her legs bothering her rather than her back. She's got both back pain and leg symptoms, but the nerves are being pinched severely in her lower back. Shot. I'm trying to get myself into that 3-4 disc space. It has not been easy. Shot. I'm going to aim a little higher. We're right there at the back of the disc. And it's very collapsed on this side. All right. Well, let's do this. Let's go to the other side. And we're going to get the 4-5. Number one agrees. Pretty much the same location on the opposite side. Shot. You can see the needle there. Shot. Shot. AP. Feel the herniation. You can see the tip of the needle right where the herniation is. Yep, looks good. I'm going to try redoing 3-4 a little bit more medial. Shot. 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 AP. You have to be careful with ladies that are older because they can have osteoporosis. You want to make sure you're not pushing through their bone. That's really nice right there at L3-4 and L4-5. You can see she has some scoliosis. She also has listhesis. We will not be fixing the scoliosis or the listhesis today. We're trying to fix the herniations and her back pain, as well as her leg symptoms. Shot. 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 Try to line up 4-5 a little better for me. We'll come back to 3-4. All right, we're going to need her awake in a moment. Is that my 4-5? That looks pretty good.
Okay, we're gonna ask you some questions, all right?
So she's already awake, ready to go. She ready? Almost?
Can you hear me? Can you hear me? Yes. Okay, we're gonna ask you some questions, okay?
Tell her everything's going well.
Everything's going well.
Shot?
This is the
I
part
think
where
that's in, yeah.
you give us a 1 to 10 number, all right? You doing all right? Okay, good.
She having any pain?
Are you having any pain right now in your back or legs?
This one's in.
Are you having any pain right now? No. She said
You're
no.
doing great. We're almost going to put you to sleep, and when you wake up, we'll be done with your surgery, okay? No back pain?
Any back pain? No.
All right. That's fine. All right. How bad is that on a scale of 1 to 10?
Give us a number.
How high did it go?
Say? 10.
Is that where you get your back pain? L4-5. All right, you get to go to sleep. She was a 10 out of 10 concordant at L4-5. We couldn't test L3-4 because I can't get the needle into the disc. It's so collapsed on the left side. So we're going to put her to sleep, and later on we'll place the guide wire and we'll be able to get in using the dilator. But right now we're going to get started at left L4-5. I'm also in at the other side. You can see the dye. You guys see this here, Sanjay?
Yes, I do.
You see the dye coming out this side?
Yes, I do.
That's because we injected it on the left. It's coming out the right. It goes through the disc and out the other needle. Pretty cool, huh? All right. Shot. So a lot of people say, Dr. Duke, don't you have to fix the spondylolisthesis? Don't you have to fix it? And the answer is no, you don't. Everyone thinks spondylolisthesis has to be fixed, that that's the cause of pain, but it's not. Spondylolisthesis is not the cause of pain.
This doesn't look nice on the X-ray.
Yeah, it doesn't look good on the x-ray, I understand, but that's not a reason to fix it, right?
No spinal
You wanna fix something that's causing problems for the patient, not something that just looks bad on the MRI or the x-ray. Shot? All right, let me know when she's asleep because I need her relaxed so I can get into this disc space. It's not going to be easy. Let me know when I can proceed. If you have questions, feel free to ask them. I'm going to try to get into this disc space. I really want her asleep because if she's asleep, she won't tighten up her muscles. If she doesn't tighten up her muscles, then we're going to be able to get into this disc space easier. You'll actually see the disc say separate. Feels pretty good. I'm just taking my time, going real slow. Hold on. Shot. I wonder, maybe a little bit more before we pull that guide wire. Shot. Any questions from the audience, Sanjay?
No questions so far.
Yeah. Shot. Very nice. Feels good. So we're literally inside the L4-5 disc. We went through the herniation, and I actually pushed the herniation back in. So it's going to be easier for me to take it out when the herniation is inside the disc. All right, looking good. Huh? They're both hard. They're both hard. But it went in great. She separated nicely. Any questions from the audience?
Yes, we have a question from Jana on YouTube.
Sure.
How can you get to the back of the disc with no distraction? I mean, the disc is pretty thin.
All right, I almost heard that. One more time, Sanjay.
How can you get to the back of the disc
Yes?
with no distraction?
It's hard. Yeah, it takes a lot of practice. Yeah, it's very hard. I make it look easy, but it takes many, many years of your IV pole, once again, is, as always, and right in the way. We need to keep that out of there. It takes many, many years of doing this. I've done now 1,700 of these surgeries, 1,700 patients. Just endoscopic. I've also done 1,000 fusion, lumbar, 1,000 ACDF and artificial disc. I've done 500 PCDF. So I've done a lot of spine surgery. I've been doing spine surgery for 26 years as a neurosurgeon. So I have a lot of experience. Experience has helped me. I also have a very good team. I can't do it without the anesthesiologist doing his job and the rest of my team doing their job. The best fluoro, the best table, the best positioning, the best equipment, the best tools, the best of everything. If you have the best on your side, then you can do things nobody else can do. And make it look easy. It's a piece of bone spur. And also it's part of the herniation as well. Any other questions?
We have a comment from Judy on Facebook.
Yes.
Can't wait until my appointment here next Monday at 1.
Oh, wonderful. I'm looking forward to seeing you. So I do want to acknowledge today is Sanjay's first day broadcasting for us. He is taught by Henry, and unfortunately, like many people, Henry is not feeling so well today, so he is home, and Sanjay has graciously volunteered and taken over. So thank you, Sanjay. Good
Thank you
job.
for your words, doctor.
All right, so you can see down there to the left of the laser fiber, there's the end plate, which is the surface of the bone, and the disc is surrounded by two end plates, one above and one below. You can see one end plate there, the pink, and there's another end plate on this side. Any more questions?
No questions, but we have a comment from Judy on Facebook.
All right, wonderful.
She says thank you.
You are welcome, Judy.
We have a question from Jonna on YouTube.
Yes.
She says, how do you know how much of disk to take out?
How do I know how much of the disc to take out?
Yes.
That's a very good question. So the answer is we're not taking the disc out. We're only taking the herniation out. We don't take the disc out. The disc is normal. We don't want the disc. See this piece right here? That's not the disc. That's a herniation. And it's stuck in the annular tear. So the herniation comes into the annular tear, and then it creates inflammation, and the inflammation makes the herniation stick inside the annular tear, which then makes more inflammation. And so much inflammation makes so much pain for the patient. Back pain, leg pain. This is all herniation here. I'm cutting it into pieces, you see, with the laser. And then the pieces are coming out. Or sometimes they stay. They need a little, what do you call it? Incentive to come out. This is all herniation. This was pushing on her nerves, going in her legs. She had horrible pain in her legs, discomfort. This is all herniation here, big one, all scarred up. And I'm chopping it into small pieces with the laser, taking them out, little bit at a time. Keep the questions coming. These are all good questions.
We have a wonderful question from B3 on YouTube.
All right.
Hi doc, what
Hi.
happens if you only use the grabber to get as much herniation as possible without using laser?
It doesn't work. Great question. So if you only use the grabber, can you get the herniation? No. The herniation is stuck by scar tissue to the annular tear. And if I only use the grabber, it will not get the herniations. It will only get some herniation. Not enough. Maybe 10%. No more. So you really need the laser. The laser is the most important part of the surgery. That's why we call it Duke laser disc repair. You must have the laser. The name shows the emphasis of the laser in the procedure, why it's so important. The surgery cannot be done without the laser. I know laser is expensive, and nobody wants to buy it because it's so expensive, and it's so hard to find. But you have to have the laser. No laser, the surgery doesn't work. Good questions. You'll never see me do this surgery without the laser. If the laser is broken, I'll cancel the surgery. I don't believe in doing surgery that doesn't work. I would never do surgery on somebody that doesn't work. And without the laser, I know 100% the surgery will not work. So I won't do the surgery. I'll postpone for another day. That's how important the laser is. I want to buy another laser, but they're so expensive. We need to look again.
Yeah, yeah. I still have the rep, not the rep, but the people that actually help me fix it. Do the
Yeah.
payment to keep
But
it
the
for me.
last time we looked, we found the used one, but there was a problem, right?
Well, the problem was it was too old.
Yeah.
Yeah.
Is there anything newer
Like,
available?
It's
Huh?
very difficult to find the same one. It's gonna be like maybe a couple of years.
Well, find it.
And then the new one, you don't like it. It's,
The what?
the new one is come with a different software and all that stuff. And
Are you kidding me?
oh yeah.
We're not gonna like it?
Well, it's the one that come with a different pedal and
I don't understand.
yeah, it's a different software. I mean, it's about the same, but it's different.
How? I mean,
The software.
different in what way? Significant?
Like you can have actually more energy one pedal, and the other pedal is going to be different energy. You can manipulate it.
I want just one pedal.
That's what I'm saying.
They won't give it to us. What?
Yeah, that's what
Call
I'm
the rep.
Yeah.
I'm serious. Call the rep. Tell them to bring it. We want a demo. Okay?
Yes, sir.
We're gonna need to do something, Luis,
Correct.
soon.
Yeah.
Are you saying these things are not anywhere on the market?
They are, but they are old.
Too old. No, I don't want old.
Exactly.
No, I don't want old. I don't mind a little bit, maybe a few years, but I don't want something too old that it's gonna break all the time. All right, Sanjay, any more questions?
Yes, we have a question from Ronald on YouTube. He says, "Good afternoon, doctor.
Good afternoon.
How close are you to the spinal cord?"
Spinal cord, we're not anywhere near the spinal cord. We're in the lumbar spine. There is no spinal cord here. It's in the top of the lumbar spine. The spinal cord ends at L1, T12, L1. We are at L3-4, L4-5. We are near the nerves, but not the spinal cord. All right, you can see the vein. I think that's good. Yeah, 1 minute, 2 minutes. Huh? Yeah, no, I'm done.
Nice one, please. Thank you.
I need suction on my tube, suction on my tube. Scope off, suction on tube. I don't need this. Right? Let me have the dilator. Tube suction is good, thank you. And no iodine, right?
That's correct.
All right, one down, bring it in. So, my wife calls me and she says, that one. I'm going home. The dog is sick. My dog is sick. Scooby. So she showed me a video. He was crying. I've never seen him like that before. Thinking, what's going on here? Turns out he went to the vet. He had a chicken bone stuck in his butt. Like he had eaten it and it never got digested, I guess. Someone had given him a little piece. And he's a miniature Dachshund. A miniature Doxy. Huh? Uh-huh. He never complained once in his entire life. This is the first time he ever looked sick. So my wife knew there was something wrong. And she was astute.
So the vet dig it out?
Yeah, yeah. I guess they figured it out. I was impressed. I thought he maybe had pancreatitis. You're moving it north.
Got a little bit of proctitis, maybe.
He had proctitis. Yeah. It's exactly what he had. Shot. 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 All right, so we've managed to get all the way down to the foramen at 3-4. I'm literally just outside the disc here. I feel it. Let's get rid of this. Let's hope. Shot. Shot. That feels good. Look at that. It opened the disc up. Thank you, Dr. Berndes. Perfect anesthesia. You guys see that? It literally opened that disc up. I couldn't get the needle in. The needle is 1 millimeter. The tip of the needle is like literally 0.5 millimeter to 1/4 millimeter. I couldn't even get that in. And yet, once the patient was asleep, she relaxes her muscles of her spine, and you can separate the bones. All right, let's get it out. And get into the disc, which is what we did. You can see how thin she is. She's a thin lady, very well kept. And the tube is sticking out quite a bit because she's so thin. Of course, we use the same tube for everybody, no matter how big they are.
Stop on this video.
All right, any questions?
Yes, we have a question from Ronald on YouTube.
Yes.
He asks, Doc, does the herniation ever come back?
Does the herniation ever come back after this surgery? Yes, 1%. 1% of our patients, the herniation comes back. Usually they're doing something they're not supposed to do. Some kind of heavy lifting, bending, twisting. All right, you can see here that there's the end plate, the cartilage. You guys see all the cartilage there on the bone? That white stuff, look how bad it is, in such bad shape. Damaged, it's arthritis, okay? So there's not much disc left here. It's very collapsed. It doesn't matter. You don't need to do a fusion when you have no disc left. It doesn't matter. All you have to do is the laser surgery, Duke laser disc repair, and the pain will go away. Because the pain doesn't come from bone on bone. The pain doesn't come from listhesis. The pain doesn't come from kyphosis, scoliosis, any of those deformity. It comes from this tear in the back of the disc where the herniation comes out. This is what causes back pain. And if I remove this, the patient's symptoms will go away. There's no magic to what we do. Any doctor could do this. Any skilled surgeon could do it. We just discovered it at Duke Spine Institute. We were the first to do it, and we've been doing it 17 years. I have to get used to saying 17 years now. 17 years. All right, other questions?
Yes.
Look at that. See that right there? That's what's pushing on the nerve, causing leg symptoms. We're going to debulk it. Sorry, go ahead, Sanjay.
We have a question from Ronald on YouTube.
Hello, Ronald.
Doc,
Yes.
what if you have a problem and pain in your lower and neck pain and affecting my legs mobility?
What would I do? I would get an MRI scan first, an MRI scan. Then I would do the free virtual MRI review with Duke Spine with Dr. Duke Majan. It's free. We don't charge. And I would get my diagnosis, what's wrong, how to fix it. That is all free. We offer it to every human being. All you have to do is go to our website, fill out the free MRI review. You put your name, your phone number, do you have back pain, leg pain, which side, how long have you had it, what treatments have you had, just basic information so we can help you. And then you get a consultation with me. Okay? I spend 10 minutes with you, free, no charge. and I will tell you what's wrong, and I will tell you how to fix it. If you want to fix it, you fix it. If you don't want to fix it, you don't fix it. It's okay. We do those MRI review every week. Almost done here. 1 minute. And then I'm going to go to the last disc. Every week we do MRI review. Probably 100. All right, we're out of the disc. It looks good. It's all bone. I don't see anything else.
Lights on, please. Thank you.
I need suction on this tube, guys. Keep turning it off. Yalla, Habib. Oh, please. It's not on. Scope off. It's 100% not on. I've been doing this 26 years. This is blocked. Unblock it, please. Easy, 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 easy. There we go. All right. Look what came out of the tube. You guys see it?
Yes, we do.
Keep the suction on the tube. Good. Very nice. 2 down. 1 more to go. Some of you may notice that the drapes on this patient look different. You guys see this? This drapes here? It's not the usual dark color. That's because this patient has an allergy to iodine. So we did not use our Duraprep, we did not use our Ioban, we do not use betadine, and we do not use iodine dye within the discogram. So that's why you can't see the tears on the x-ray. So we had to remove all the iodine. I need my pedal. We only do this when patients have allergy to iodine, they tell us. So that's why it looks different. All right. Shot. All right, shot. I think she's going to do fantastic with this surgery. We have 10 minutes left, doctor.
Next patient's here.
Shot. There we go.
Squat.
Let's get another dilator. Get another dilator.
You wanna help me?
Can you get another dilator, Jordan?
He's coming, yeah.
It's all right. What happened is when we went in that last disc with the dilator, the front of it has these little holes, and they bone went inside them. Hey, Luis, make sure we get that cleaned out.
Oh, yeah.
So we're getting a new dilator. This is the dilator, by the way. And we're going to run it right down the guide wire. Shot. Amazing. Shot. All right, so now we have to get into this disc once again. I like to try to angle the dilator to where I know it's supposed to go. Shot. And you got to be careful with your guide wire. If you pinch it too hard with the tip of the dilator, you'll never get it out. Well, I got it. Uh-huh. Here. And you have to do some tricks sometimes to get it to work. And you have to yell at it. We say, Yalla. Perfect. Yalla is what my dad said to me when he wanted me to hurry up. He said, Yalla. My dad spoke 7 languages fluently, including Arabic, because he had to live over there. He had to escape Egypt as a doctor. They didn't want the doctors leaving Egypt. No. No, the government back in the 60s Nasser. Nasser was in power, and he hated Christians. So they did everything they could to harm the Christians. And the Christians ended up trying to leave Egypt, but they wouldn't let them fly to America. So they had to go to countries that were Arabic around Egypt. And he ended up in Lebanon. And eventually New York. Any questions?
Yes, we have a question from Ronald on YouTube.
Of course.
He says, Doc, I really need your help. I had back surgery in 2005. So, do you treat stenosis?
Yes, we treat stenosis. Of course. All of these patients we're treating have stenosis when we treat them. And we're fixing their stenosis. But we're doing it without open surgery. We're doing it with endoscopic surgery. There's a way to treat stenosis. You see, most stenosis, and doctors don't know this, most symptomatic stenosis is in the lateral recess or neural foramen, in the lumbar spine. Okay, which means it's off to the side. To the side. And that's right where we go. We come in through the side. So we're able to find the stenosis right away and fix it without doing open surgery. Doing endoscopic only. This is the best treatment for spinal stenosis. You're watching it right now. Thanks. Good job, by the way.
We have a follow-up question to that from Ronald on YouTube.
Okay?
Doc, do you accept Medicare and Humana insurance?
Medicare and what?
Humana?
Well, first of all, we accept all insurances. However, not all insurances will pay for all the treatments we do. Okay? I take Medicare patients, and since I don't get paid by Medicare, I will see them for free. That doesn't mean I do free surgery, but I will see the patients for free. In the end, the truth is, the insurance doesn't pay very much money for the office, and they don't pay much money for the surgeries either. But for me to help people, I see them for free, but I can't treat them for free. So it's important to get the right diagnosis, and then you decide if you want the right treatment. There's a herniation there. You guys see it? Very dry, very dried. That piece of herniation, very dry. Feel that? Yeah. It's out. 5 minutes. 5 minutes, we'll be done. And then we have one more surgery. The last patient. Where is this patient from?
Pennsylvania.
This patient is from Pennsylvania, this one. The one before was Ohio. And then we have another one from, no, the one patient we had from Rwanda, Africa. Rwanda, Africa. So today we had Rwanda, Africa, Houston, Texas, one from Ohio and 2 from Pennsylvania. Amazing, huh? All here to Florida for this surgery because it works so well. These poor people, they're not given any hope or options where they live. The doctors don't know how to fix them. And the only doctors willing to treat them are doing fusions and spinal cord stimulators, treatments that don't work. They come here and we fix them with laser surgery and they go home and they're happy. Pretty much done. Look at that. There's really not much disc left. It's all gone. And the nerve is there. Hey, there's a little bit of something there. Let me have the laser. If you go to my Facebook page, you'll see Scooby. If you want to see what Scooby looks like. He's a very cute little dog. Very sweet.
Everybody loves Scooby.
Scooby. He's named for Scooby-Doo. Yeah, Snoopy's a good one. All right, good job, everyone. We're done. Oh, we got to do the DPR. Oh, I apologize. Thank you. Getting a little ahead of myself. We're done with the discs. We're not done with the surgery. We're going to do the DPR. Which side is the DPR? Left. I'm gonna come over there, just because I feel like it. Next, we're gonna treat her facets on the left, L4-5 and L5-S1. Pressure here. All right. You want to staple that? Oh, actually, keep pressure for a minute. All right, let's get the fluoro in. We're gonna do the facet treatment, 4-5-5-1. So for those of you who don't know, this next treatment is to treat painful facet joints. Move your hand. Shot. Come to my side. My side more. Shot. All right, so there's 4, there's 5, there's S1. So, shot. I'm on the transverse process. Num num. Go ahead. What are we doing? We're actually burning the nerves that go to the joint called the facet joint. And the reason we're burning these nerves, we're trying to cut them, destroy them. These are not good nerves. These are bad nerves. They're doing bad things to this patient. Shot. They're causing horrible pain for her. Shot. Shot. Jordan, what do you think? That's 4? You agree? Shot? Yeah, shot. That looks like 4 to me. And I'm right on the bone. Wait, shot? Yeah. Very arthritic facet. That's 4. You agree, Jordan?
Yes, sir.
Shot. Let's go get 5. Shot. That looks like 5. Shot. Perfect. I love it when a plan comes together. Any questions? Look at how arthritic that joint is.
No questions so far.
All right, shot. We're almost done. Shot. Shot. And shot. 1 minute. Berndes. All right, folks. Hope you've enjoyed this shot. It's a perfect spot right there. Huh, Jordan?
Yes, sir.
You just go tell Dr. Patel, okay? Great job, everyone. You tell Patel when he's ready to see how it's really done, he comes in here. Just having fun. Dr. Patel is my partner. He taught me everything I know. Everything Berndes didn't teach me. All right, one more to go. Hope you enjoyed DLDR and DPR. Combination treatment, disc and facet, treating stenosis, discogenic back pain, radiculopathy, neurogenic claudication, facet joint pain. Great job, everyone. One more. EBL, I'm going to say 3 mil. This is DLDR, bilateral, L4-5, and it was a left 3-4, right? Everyone agree? Left 3-4, bilateral 4-5. Come on in. No. Thank you, though. All right. Well, I enjoyed our time. We have one more surgery. If you want to join us, you're welcome to. Sanjay, I want to say you did a great job. Are there any questions?
No questions so far.
All right, you can end the broadcast.
Okay. Copy that.
Thank you.
Ending broadcast in 3, 2, 1.